Thoracic spine rehabilitation is performed by using the use of a tube. In order to perform this, we need to tie two small loops in the ends of the tubing, such as this. The bow line is very nice because it never ever comes undone. First, we have to polish the damaged facets, rib heads, or discs of the thoracic spine. This is performed by putting the tubing around both wrists, placing the tubing around the doorknob or any other stable structure. Make sure that the two knots are equidistant away from the door. Then, with light circumduction, you can then traction as far back as you need until you feel it in the affected portion of the spine. Until you feel the correct tension, then lift the chest to neutral, pull the hands back till they touch the ribs, getting in a comfortable position. Then doing a short range of motion, pumping action, pulling the shoulder blades together and back. Three stretches of the thoracic spine, even like for thoracic outlet syndrome, would be to do a side stretch, placing the tubing both around one wrist and leaning the head, stretching the neck down into the arm. Then, facing the door, sit in the sumo position with the chest up, hand on the knee, push and twist, stretching the rib heads. Then you can even grab the arm and do a complete side stretch where you maximize the stretch of the shoulder joint, pulling the scapula around the front and opening up the rib heads and back. Then you can work the lower ribs by taking the tubing, holding it in one hand, doubling it up, putting your hand in this fashion. 2 fingers in, 2 fingers out. Place the tubing over the top of the door. Hold the door with your belly. If you pull, leaning back, the tubing is going to come off the top of the door and hit you in the face. So make sure the tubing's over the door. Lean against the door. Elbows down, pulling your elbows down to the 12th rib. You can also place the tubing under your foot. Stand in neutral position. Pull the shoulders up to the point of tension. So comfortable position, comfortable short motion. Adjust the tube tension and do short shrugs until it feels comfortable. The antagonists of the back ribs, meaning the chest muscles, also need to be worked in some conditions. This is done very well by placing the tubing around the door, making sure the knots are equidistant from the door. Taking one arm, placing it over your head, holding the tubing around your thumbs in this fashion. And then you can work lower pec, middle pec, upper pec. Or upper ribs, middle ribs, and lower rib cartilage.